Hi, welcome to Oncology Mythbusters. I'm Dr. Del Rosario, and in this series, we're here to debunk the biggest cancer myths and give you the facts that you deserve. There's so much misinformation out there, from miracle cures to scary stats, and it's time to set the record straight. So, in this episode, we're going to talk about a very popular myth that only smokers get lung cancer. According to the American Cancer Society, approximately 10 to 20% of lung cancer cases occur in people that have never smoked. That's 1 in 5 people. Today, we're going to learn about the hidden risk factors like radon and air pollution. So, what are the origins of this myth? Smoking accounts for approximately 85 to 90% of lung cancer cases, according to the CDC. This is basically based on historical and anti-smoking campaigns such as the Truth Initiative, which focus almost exclusively on smoking. And don't get me wrong, smoking is bad for you. It does cause, a majority of lung cancer, probably 80% or more. But you got to remember that there are other causes of lung cancer as well. Tobacco is still the leading cause, but focusing only on smoking overlooks other very important risk factors. So what are these non-smoking risk factors? One, there's secondhand smoke. This causes the next majority of lung cancer cases, almost approximately 7,300 deaths from lung cancer each year. Another very popular one that I didn't really learn so much until med school was radon exposure. This is the second leading cause of lung cancer in the U.S. and it's responsible for 21,000 cancer deaths annually. That's a lot of cases. Air pollution is also one that most people are aware of. There's something called a fine particulate matter, and this increases lung cancer risk by 36% for every 10 micrograms per meters cubed increase in pollution. So there's also genetic predisposition. Certain gene mutations like EGFR are more common in smoking lung cancer patients. And this is usually in the younger Asian women, usually Southeast Asian like Korean, Japanese, Vietnamese, Filipinos, Chinese. They tend to get this type of mutation. And they do have specific drugs targeted to this mutation just because of this case as well. There's also occupational exposure. Asbestos exposure increases lung cancer risk by 5 times. So asbestos, stuff in the ceilings that they used to put, was actually a very common cause for lung cancer. And it's usually something we were actually tested on boards throughout medical school and residency. So lung cancer in non-smokers, according to the American Cancer Society, 12 to 20% of lung cancer patients are non-smokers. In the U.S., lung cancer is now the second most common cancer among non-smokers, which is after breast cancer in women and prostate cancer in men. Although it's the second most common, it's the number 1 common cause of in cancer cases in the U.S., which is very important because you want to live, right? Women are disproportionately affected for non-smoking lung cancer. About almost 2/3 of lung cancer cases in non-smokers occur in women. And this is from the Lung Cancer Foundation. In East Asia, as I mentioned earlier, the EGFR mutation is found in 30 to 40% of non-smoking lung cancer patients. So that's almost half of the non-smoking lung cancer patients, at least in East Asia, you can get this EGFR mutation, which is very important for drug therapies because you do have certain medications that target this EGFR mutation. And when you have targeted medications, it usually leads to better outcomes with less side effects that you'd normally get with chemotherapy. So there's a very high importance for early detection. One that you can do at home, there are certain symptoms that you can look out for. I don't want to be Dr. Google or anything, but there are very particular symptoms that you should be aware of and you should probably tell your doctor about. Usually this would include like a persistent cough that usually lasts over 3 to 4 weeks. If you have a daily cough that just lasted for a few days after a cold or a week even, and you ruled out other causes, reflux disease or sinusitis, you should probably tell your doctor about it. Unusual shortness of breath. The big one that I see a lot is unexplained weight loss. Usually more than 5 to 10% of your body weight over the past month or so, and you can't really explain it. You're not on a new diet, you're not on a new exercise regimen, you're just losing weight. You should probably let your doctor know. Chest pain that worsens with breathing or coughing. This is usually due to something called costochondritis or inflammation of the rib cartilage here. But sometimes lung cancer can present that way. These are definitely things that you should tell your doctor about. The reason why this is so important is because if you detect the lung cancer early, the survival rate is a lot better. Early at stage 1, usually 6% of patients would live up to 5 years. That doesn't sound like a lot, but that just goes to show how deadly lung cancer is. There are certain scenarios where you can screen for lung cancer, something called a low-dose CT scan. This is usually for patients who are lifelong smokers, and there are certain guidelines that change every day, but sometimes you do want to let your doctor know if you do smoke a lot, especially more than 15 years, that maybe you could be a candidate for this screening tool. So what are things that you can do? For radon testing, as I mentioned earlier, there are home radon test kits that I can show up here that cost about $10 to $30 on Amazon, and they're available online on Amazon or any hardware stores. You could check air pollution monitoring. There are various apps that you can look for air pollution where you could decide not to go outside. These apps include Air Visual, which provide real-time air quality data. Something in your workplace, occupational safety, especially if you work in construction or manufacturing, or if you flip houses as a realtor or real estate investor, you should be very aware of asbestos exposure and follow your local OSHA guidelines for the asbestos exposure. And then lastly, genetic testing, which is a very hot topic in cancer these days, something called personalized medicine. Especially, if you're younger and Asian, or if you have a family history of cancer, you should talk to your doctor to see if there are any available tests that they can check for. Something that, as I mentioned before, like EGFR. There's also another mutation known as ALK or ROS1. So these are very important things that you can talk to your doctor about as well. So the myth is that only smokers can get lung cancer. That's not true. A majority of patients, about 80 to 90%, would get lung cancer from smoking. But you always have to remember that there's a remaining 10 to 20%, which is a significant amount. 1 in 10 to 1 in 5 people can get lung cancer. And there are certain things you can look out for these types of situations. Things that you can do at home, as I mentioned before: test your home for radon, be aware of air quality and hazardous exposures like asbestos, and pay attention to your symptoms. Even if you've never smoked, these are definitely things that you talk to your doctor about and you should definitely bring up. So in closing, share this video to help others and stay informed, and subscribe to more myth-busting episodes.